Hey guys, it's another night, another podcast. We have our pleasure have our new guest, Dr. Alla Shtilman, dentist working in Buffalo Grove, our neighbor. And we're gonna talk about life as usual. What's new, what's old, what we're gonna do, what we did bad, or what we're gonna do good. Doctor, nice to meet you.
Yeah.
Pleasure is mine. Yep.
Thanks for having me on.
As usual, first question. Why and how you become a dentist? Why you just, I know it's the hardest profession and professional I can say in the world, because I know it's so hard, people. You guys sitting like this, you're just looking at there, your eyes getting bad. Why?
That's a great question. I think I was a very strange child because I was one of the few children that actually enjoyed going to the dentist.
Wow.
Even back in the Soviet Union, during those wonderful times. But it was never a place of anxiety or stress for me. It was,
naturally.
It was a natural thing.
Yeah.
But later in life, I have an aunt who is a dentist who just loved the profession, just very passionate about it. And I started working in her office as a teenager. I've done pretty much every job possible in dental office, from sterilization to front desk, assisting, and finally it just seemed like the natural thing to do. It's my happy place. I enjoy going to work and enjoy being there. So,
what school did you go?
I went to UIC.
UIC. Wow. I know it's so hard to get in. It's mean you have to be really, really good to get in UIC.
Yeah, it was a wonderful school. It was a great program. Definitely very difficult to get in and difficult to finish, but it was a journey of many steps.
Did you have any specialization, or just you finished for general dentistry?
For general dentistry, yeah.
But did you have any desire to become, let's say, a prosthodontist or a surgeon, or it's too much?
I never really picked one area that I liked more than another. I felt that doing any one thing would grow a little tiring. I like the variety of doing many different things. And that's something I carry over into my practice.
And nowadays, like, everybody can put in implants. Like way before, you have to be oral surgeon. But nowadays, if you finish, let's say you got a course, you finish, you can put it. Do you do a lot of implants, or?
I do. Yeah, surgery is actually one of my more favorite things to do. I do a lot of extractions, implant placements. I dabble a little in orthodontics as well, alignments and things.
Good to know. Yeah. Good to know. It's gonna be competition with Dr. Razdowski.
No.
I know it's hard to compete with him. I know, but being in dental school, was it hard or was it easy for you because you like kind of natural love this dental stuff?
Dental school. In dental school, we had a motto, and it's work hard and play hard. So we did have a lot of fun with classmates, after school hours, obviously. But it was a lot of work.
A lot of work.
Yes. I remember one particular week, our first year, where we took 11 exams on anatomy, physiology, pharmacology. Wow. I remember thinking after this week that, you can give me a test on Chinese, I'll pass that, anything.
And I can do it. Yeah. But I know, like, pretty young, when you were in school, it already was digital. Like, did they teach digital or not yet?
They did not. No, it was right on the cusp of it. I think maybe the class or two after I graduated, they started incorporating it.
It's mean you, like, kind of old school, you did everything analog, like impressions. That means you know how to do.
Yes.
Because I know it's so hard.
Yes, I set my own denture teeth.
Wow. It's mean you can do denture.
I can, yes.
Good to know. If we need help, we can call you. You can stop by and teach us to do, because I know it's so hard, especially for old people when we have to do like all this denture partial. It's much harder than to do digital right now, like all crowns, because you need to. I mean, first you have to have insight in your heart how to do everything. And did they teach you a lot in school about this or no?
About
about dentures, partials, like how to set up everything.
Oh yes,
yeah. Exactly.
Yes, definitely. We had to do our own denture setup from scratch. All the wax, we had to set all the teeth, everything. All of our cases were done this way.
Wow. Do you remember like your first case? Well, because usually first case is going to be in school.
Yeah.
I mean, and usually it's your brother, mom, or whatever, right? Oh.
Do I remember my first case? Yeah. I don't remember my first case in school because we had several that I assisted with and did, solo. One of my first implant cases was on my father, so that was memorable. And it's still there. So
it's still in.
Yes.
Wow, it is success. But usually, because I know at school it's hard, but usually when the students, they're young, any funny stories from school, like from dental school?
Funny stories. We have many funny stories, but I am sworn to secrecy. So.
Without no names. No names. Like sometimes, I know, because instead, for example, on a central, we're going to put this crown on a molar and it doesn't fit and people get, it's example. For example, I know, I know it's happened.
I've known many people who their first crown that they cemented had to be immediately cut off and removed.
It is happening. Yeah,
it happened.
But basically, when you finish the school, you just start your practice right away, or just work for somebody?
No, so I did work as an associate for several years, mostly in Mundelein for my aunt.
Okay.
That's where I worked for about 7 years before starting my practice. Yeah. Several other locations in Palatine and McHenry, but
is it hard? Was it different, let's say, working for somebody or own your own business, especially dentist? I know.
It is definitely more difficult to own your own business. There's so many things that you don't even realize that go into it. Not even just the staffing and like legal aspects of it, everything. It's a really
talking
big
about
job.
staffing, how hard nowadays to find somebody?
It depends for which position, but it's
let's say
difficult.
Hygienist. I know. Yeah, I know, right?
Gosh.
Yeah.
It's quite difficult. I think a lot of hygienists are starting to go where they temp, and that's kind of the direction a lot of them want to go to. But so it's challenging to find someone who wants to.
I'm just every time asking the same question because I don't know why. Why is because I know everybody's struggling with hygienists.
I think kind of just like nurses are difficult for our hospitals to staff right now. There's a little bit of a shortage. There's also a lot of mobility, and I think a lot of practices are open to having someone come, as a temporary employee. So there's a lot of movement right now. Yeah.
If we become more digital, do you have already in your office some digital stuff? I know, intraoral, for example, or 3D printer.
I do have an intraoral. The 3D printer is going to be my next big purchase, but yeah.
And
it's a lot of
do you
fun.
have success using intraoral?
Definitely.
Everything.
It's my favorite thing. I would say 99% of the time that's what I'm using.
Almost no more impressions.
Almost, yes. There's some implant systems that I still have to do an old school impression for, but yeah, I prefer the digital. It's easier.
Let's just forget about teeth, and I know because it's kind of boring, but in your free time, what hobby do you have? What the most? I know family, kids, but it's forget about it.
I do a lot of yoga. So I do that. I also snowboard, so that's my favorite.
Next question:
winter.
Where do you like to go snowboarding? What's your favorite place?
My favorite place is Breckenridge, Colorado. That's my
next to
go-to. Yeah.
Next to Vail.
It's next to Vail, but
it's favorite. Okay, it's good to know because my kids every time we just came back from Utah.
Okay.
They scared them, but
the snow out there right now is, I heard, amazing. So
it was no snow at all.
No snow.
It was like a spring in there.
Oh my gosh!
So Salt Lake City was like 3 weeks ago.
3 weeks ago.
It was like a spring. Nothing. In mountains they have snow, but probably they made it. But I know I'm not skiing. But their favorite place is Vail.
Vail. I
don't know why, but next time they said they want to go there to Colorado to go. Do you ski like from your kids age or just?
Actually, I used to ski when I was younger, but I switched to snowboarding as a teenager. That was the cooler thing to do.
Yeah, because I know it's cool. Yeah.
Definitely, a lot more challenging than a big workout.
And you're not scary, because I know all dentists scared to ski or do something. My hands have to be in a good position.
Yeah, actually, when I first finished dental school, and maybe about 4 months into practice, I did break my arm snowboarding. But yeah, that was fun. I had an assistant put gloves on my casted arm.
Wow. But, and in your practice, how usually you keep in your practice, like you strict, or it's a family, or it's because, like, let's say in my practice, we keep kind of more family style. That's mean everybody like each other, but I don't know if sometimes it doesn't work. But I don't know. I ask everyone because I need to find the way how it's gonna work for me.
Right. The goal is always to have a nice, happy family among staff. And I would say most of the time that's the way it goes. I don't like to micromanage. That's not my, it's not my style. But I do have some great employees that are just self-motivated and
a long time with you. And I just want to say, in the office, how I know the worst part we technician, we're kind of between you and the patient, but you directly deal with the patient. How hard is it? Because I know it's hard. Some patients easy, but most of them, But what hard? How you need to deal with that?
Most of the time patients are great, and it really is, you're almost a psychologist as well as a dentist, where you have to navigate, people's personalities, their fears, their anxieties. I'm in a position where I tend to attract very highly anxious patients. My office style is more of like a calm, spa-like experience. And we offer nitrous oxide laughing gas for patients. So we kind of set up everything to try to
calm down,
to help patients calm down and feel more relaxed as much as they can.
But sometimes, sometimes patients say you have to listen stories, you have to become a family. How hard? Because you have to listen. I know it's hard, right?
Yeah, those are actually my favorite patients.
Really?
I don't find those difficult at all. But sometimes patients, because it's just they're always anxious in the dental chair. And some people find it more difficult to manage their emotions. So, if people are, they don't understand something, or they can get a little aggressive, that'll be the more challenging. But
as a dental technician, in your practice, I know what for you more harder to do, let's say, like molars, or for you it's easy, it's hard to do, let's say, front teeth. I know front teeth is much harder, but front teeth is harder for us because we have to make it. I know for you, what's you dealing, what's the best way for you to explain?
Essentially, so for example, preparing a tooth for a crown is easier on the front teeth, right? We don't have to.
You don't have to go
all the way back. But the aesthetics are far more important for the patient. So in that respect, it's not just a hard job for you to make it perfect. We have to make sure that the patient's happy, everything's perfect.
And sometimes front teeth, you're not gonna do from one time. You have to do one time. Shade doesn't look good. You have to do second time. And usually, patient they get anxious. Come on, we have to do it, right?
Yes, so I try to set up expectations, from the beginning. I let them know, this may take several fittings. I don't want you, if it's the first time, wonderful, but I don't want you to be upset or anxious if it comes back a few times. That's normal. So,
in your office, you're a coffee person or a tea person?
No, I'm a tea person.
Tea.
Yes.
Usually it's a coffee. It's a tea. Okay, what's your favorite tea?
Green tea.
Green tea.
What I drink. Yes.
No Earl Grey or no?
No. I
because it's yoga. Because it's yoga, it's a green tea. And let's say in the free time, if you're not skiing, or what you usually, if not because skiing, yoga, in your free time, what do I do? In my free time, I am a mom. So that's it's no free time. Okay.
No free time. That's my 5 to 9 after my 9 to 5.
Do you your office hours like every day, or you have like a couple of days? Usually Sunday.
The only day I have fully off is Sundays. I do work every other Saturday. Yes.
That's when
yes.
you're so busy. Wow. Because I know doctors, they usually work Sunday off and a couple days of the week they off too.
No, not me.
No privilege.
Not yet.
No privilege. Not yet. Do you planning to open other offices too?
Perhaps in the future.
Okay. Any question to me? What do you have? Any interesting question to me? Any question.
What are some of the most interesting cases you've worked on?
As you know, we do mostly like kind of big cases or next cases. And most probably challenging when we do zygoma implants. Doctor do zygoma, it's when they go all the way there. This is so much challenging because you have to make all the way down, and for us, let's say angulation, yeah, and usually not so much bone. It's mean we have to create something. This is kind of challenging, but more interesting cases too, and and for us, like I ask because of patient, because we deal with patient lots too, because usually doctors go away and we have to explain patient how it's gonna look, and this is most challenging, especially for me, because sometimes patient doesn't have any idea how it's gonna be, and I wanna like this, but I have to explain, no, it's impossible.
Yeah, you have to manage expectations.
I wanna like this. I said, no, it's expectations so high, sometimes impossible to do, but we have to deal and we have to finish.
Yeah.
And it's kind of, let's say, 2 central crowns, but full mouth reconstruction. It's kind of looks exactly the same. It's so hard, but we have to do it.
Make it work.
Yeah, we have to work.
Have you ever had any cases where a patient repeatedly would break their prosthesis?
Repeatedly, maybe a couple times, but we have cases when we did, like, let's say 6-time temporaries, because patient, they don't know what they like. They say, I like this. We did, no, I don't. Another temporary, I don't. And this is kind of, for me, it's kind of most like, oh, but finally we have to finish.
Patient,
But listen, we finish every case we have to finish. And special now the technology, when you have a special scanners, when you can do like facial scan and you can show the patients how it's gonna look in the future, and then, oh my God, oh no, I don't like it. Oh my God, and this helps a lot.
Do you find that the projected outcome is exactly the same?
Yeah. It's exactly. I mean, it's impossible to do exactly the same because it's no same teeth. As much as we, let's say, temporary looks like that, and we finish a final, it's still kind of, you can see, but nobody has a perfection, right? It's, if you see perfection, that means it's not your teeth. We try to do, but again, everybody love Hollywood smile. You know, like everything straight, everything white. But listen, it's America. We have to, because when you go to Europe, it's a different story. People has even like full mouth reconstruction, different crooked teeth with like dark stain. And you never know it's real teeth or it's like,
see, this is what I like, but
nobody likes it, exactly. Yeah, but we deal with that, and kind of we have to do what we have to do. We have to please patient have to please doctor, or other way. And see, it's interesting. And let's say, what you finished, how many, 7 years ago you finished school, right?
No, 13.
Oh, you can give it a good advice to the, let's say, new generation which has come out from school with digital knowledge, or they don't know how to take real impression. What's your advice?
My advice is to listen to mentors. Straight out of school, you don't know much. You know some, but if you can find a good mentor that can help you, guide you, helps you see where you've made mistakes, it's so valuable. Does
mean your mentor or your aunt, right?
Yes, I was very lucky.
It's easy. It's easy because I mean, you start from probably assistant to little part-time hygienist. Because let's say if you don't have hygienist, can you clean teeth by yourself?
I mean, all dentists can do that, of course, but
not everybody doing.
Not everybody wants to.
Why?
No, it's more fun to make crowns and place implants, of course.
But do you planning to put more and more implants in your practice, like by yourself, or it's still some implants kind of hard to do? I mean, because
I do most implants by myself. The only ones, if there's a sinus lift that needs to be done, or ridge augmentations, we tend to.
Do you have a favorite implant system?
I like Straumann. That's my favorite.
Okay, probably I have to call Joe. He will.
I know Joe well.
See?
Have him on speed dial.
Yeah, speed dial, exactly. He's a great guy. Straumann, yeah. Because I know nowadays, so many people going to, let's say, out of country to do dental job, and they come back to us, to you and to us, after some, not everybody, but I can say 70%, I can say this number, to redo. Because I know they go in there to make cheap, come back to redo. And sometimes we don't know what, I mean, how many times I can say, I don't know what kind of implant system, because it's no idea what is it. Nowadays, it's so many. But what we find out, if you use, probably some dentist is going to be mad at me, but whatever, if you use like normal, like already established implant system, I know it's going to be good result, because you have support, you have warranty. I don't know. It's just my opinion.
Oh, no, agreed. The warranty is what's really important, because I feel like internationally dentists are using more mainstream systems. I'm seeing better and better work coming back from abroad, but there's definitely been cases where we have to, figure out what implant this is, like figure out what, yes, and you go down this rabbit hole calling different companies, trying to figure it out by the, its shape on the x-ray, which is always fun.
Thank you, doctor. Thank you so much.
It's a pleasure.
Thank you. Thank you.